Hello and welcome to yet another episode of Medtalk with Syed Raza. Tonight I am joined by a special guest all the way from India, and it is none other than Dr. Saima Jamal. Dr. Saima Jamal is a dentist, and welcome Dr. Saima Jamal to the show.
Thank you so much for inviting me on your show.
Okay, Dr. Saima Jamal, please tell me about your professional day-to-day life.
So I'm a dental professional working in the dental field for the last 9 years. I'm an endodontist and I cater to everyone's dental needs.
Okay, and may I ask what type of patients do you see?
I see all kind of patients in my daily life. I have patients who come to me for their um, dental problems such as when they have pain in their tooth, when they require any fillings, when they want bleaching, or when they want alignment of their teeth, or they want to replace any missing tooth, and also when they have any gum problems, and also some kids when they have any major cavity issues.
Okay, good. So there are a lot of things. And do you have any subspecialty or do you have any special interest in dentistry?
Yes, I am a conservative dentist. My specialty is endodontist. So I do root canal treatments for everyone.
Good. Yeah, so that's, I think, a common problem. But just for the understanding of the general audience, so what exactly is root canal treatment?
So the teeth has different layers. The topmost layer is enamel, and then comes the dentine, and then comes the pulp. So for the root canal to happen, or for you to require a root canal, it is a long, lengthy procedure. When the tooth is when the tooth has cavity on it, uh, it makes its way towards the pulp. So for you to have a root canal, it takes a long time for the cavity to come to the pulp. You would only require a root canal if the cavity has reached to the pulp. So, if the cavity has reached the pulp, it causes inflammation or infection of the pulp. Pulp is something like a nerves, like you have nerves on your body. The nerve of the tooth is pulp. So it gives you the sensation of hot, cold, pain. So when the cavity has reached the pulp, you get the sensation of pain. So the cavity has infected your pulp. So what we do, we remove the pulp from the tooth because the pulp is not helping you in the function of the tooth. It is just a sensation of the tooth. So we remove that pulp from the tooth and we generally clean that area, we sterilize that area, we disinfect that area, and then we seal it with our filling materials. So that is the whole procedure of the root canal.
Okay, and I understand this is done under local anesthetic. Is that right?
Yes, it is a pain free procedure. You are not supposed to have pain during your root canals. First, we anesthetize the area, we give you a local anesthesia, we numb the area, and then only we do the procedure.
Sure. And will you say that this will be the final treatment or the patients may require a follow-up treatment as well?
Follow ups are extremely important in any of the treatment, whether it be root canal or any other filling or any other dental procedure. So, I would advise once you get your root canal treatment done, after that, get regular follow ups done. Just go to your dentist, let him take an x ray of the tooth, let him see how is the condition of the tooth, if there is a reinfection of the tooth or not. So, regular checkups are mandatory.
Okay. And are there any group of patients where you would not advise root canal treatment, where the root canal treatment will be contraindicated?
Generally, root canal treatments are indicated for everyone, but only in severe cases, such as when there is no tooth structure left for the tooth, or when there is excess infection of the tooth and the surrounding tissue, when there is an abscess, or when you feel that the tooth does not have a good prognosis. Only in those situations can you not go for a root canal. Otherwise, if you want to save the tooth and you can save the tooth, root canal is always an option.
Sure. Okay, and there is a common problem is bad breath. So what's your advice to the people or patients with bad breath?
Bad breath always happen due to periodontal reasons. Periodontal reasons means when your gums are inflamed or infected, that causes periodontal problems. When there is a lot of deposits in your teeth or gums area, when there are plaque, tartar, or calculus, that causes you both bad breath as well as bleeding gums. So uh, I would suggest you to go to your dentist for your periodontal problems. Get a subgingival cleaning or get a complete scaling of your teeth, and then when you come back, you take care of your teeth and the gums by good brushing, mouthwash, and flossing, and that will relieve you of your gingival problems.
Sure. And as a just a general advice to the people who are watching this, so what's the general advice to take care of their teeth?
My advice to everyone would be please go to your dentist every 6 months. It is extremely important how you take care of your body, how you go for your medical checkups. Please go for your dental checkups. Please don't neglect your dental health. It is as important as your medical health. How you oftenly go to a physician, a general physician, how often you take your blood tests. Please go to a dentist and please take care of your dental health as well, because dental health is correlated to your medical health. So if your mouth is healthy, your body will be healthy.
Sure. So dental checkup every 6 months. And is that same for children and adults?
Children should go little more regularly because of their dietary habits, because they are not because of the brushing and dietary habits both, because it's little difficult for children to brush properly if not supervised correctly. So I would recommend that for children it's much regular checkup than adult.
Okay, since you mentioned brushing, so I'll just ask a question on brushing. So what is the minimum number of times one should brush every day? And then what should be the minimum duration for brushing?
The minimum number of time I would suggest is two. You have to, a lot of people have that conception that you should brush only in the morning, and they tend to become lazy or they forget to brush in the night. But I would say that it is extremely important to brush at night. In the night time, when you're asleep, your saliva is your mouth becomes dry, and saliva is a natural antibacterial agent which helps you against which protects you against cavity. So it's extremely important for you to go and brush your teeth and then go to sleep. For the reference of time, I would suggest a 2 minute brushing time. Just keep a time watch there. Just see that you're brushing for two minutes at least in the morning and in the day. And also, I would suggest if you can, after every meal, go to the wash basin. Just wash your mouth. If you're not at a place where you can brush, please go and rinse your mouth after every meal, just to remove any deposits, just to remove any food lodgements everywhere in your mouth. So just go and rinse. If you cannot brush.
Okay, so that's a good advice. Rinse your mouth after every meal, yeah, particularly after you have taken sweets, right?
Exactly.
And to keep that 2 minutes, 2 minutes of brushing time. So some people may be in a hurry and they will just brush very quickly. So you've got to spend 2 minutes. Okay, and so what is the advice for the general public on the use of tobacco and people? There are people who use excess nicotine, they use excess tobacco and excess caffeine. So what will you advise just from their dental health care point of view?
Both caffeine and tobacco are not good for your teeth. They are the most extremely damaging thing that you can do to your mouth. So if you are an addict, your aim should be to get your dental check regularly. You should go to a dentist. You should go there. You should get your teeth cleaned, and you should see your periodontal health of the tooth. You should get all the help from your dentist if you are uh, a tobacco addict or a caffeine addict. And I would also suggest for the general health of your teeth, just lower your consumption of caffeine and tobacco if possible.
And perhaps reducing or avoiding tobacco prevents oral cancer as well, right?
Exactly.
Okay. Fine. Now, final question. This is again a common problem. We go out in the supermarket hunting for a good toothpaste. Now, we see a lot of brands and we sometimes get confused which one to choose from. Now, I'm not asking for the brand name, but do you have any special recommendation as to what type of paste one should go for?
I would suggest you to go for any fluoridated toothpaste. Any toothpaste that has good amount of fluoride in it. That will do your work. The main thing is to brush properly, and the main thing is to have that good technique of brushing, and the 2 minutes of brushing and the 2 times of brushing. Whether it be any toothpaste or any toothbrush, doesn't matter. Any good fluoride toothpaste is okay.
Okay, so I think that's a wonderful advice. So the toothpaste is not that important, but it's the number of times you brush and how you brush your teeth. Okay, so that's a good advice for every one of us to remember. So thank you very much, Dr. Sama, for your time. I believe audience will benefit from your advice. And thank you very much for being on the show. Thank you.
Thank you so much. It was great talking to you. Thank you.
Thank you.